really quickly to apply to small cell lung cancer, Dr. Shields gave you basically the rundown of this trial: ifinatamab deruxtecan, IDXD, a B7H3 targeting ADC. This graph over here is just showing you that B7H3 is more highly expressed in cancer cells than in normal cells. This is comparing cancer cells versus normal control cells. And as Dr. Shields showed you, I think the IDXD dose of 12 milligrams per kilogram showed a very impressive waterfall and response rate for patients with small cell lung cancer treated in the later lines, which is a challenging proportion of patients to treat usually. Our old TROP2 targeting ADC, sacituzumab govitecan, as you recall, was a little bit underwhelming in non-small cell lung cancer, but in small cell lung cancer, treated in patients who have, who were pre-treated, had sort of had disease progression after first line therapy, a response rate of 42% with this waterfall. I think very exciting for these patients who generally have not had a lot of exciting options in these settings. Also quickly, this SEZ6-targeting ADC, ABBV-706, as you can see, this SEZ6 is a protein that's more highly expressed here in small cell lung cancer and neuroendocrine cancers, and here's sort of the rest of the expression across the board of other kinds of cancers. This was very exciting. A small proportion of patients, only 20 or so patients, but still a very high response rate of over 60%. And this waterfall, look at this really impressive tumor shrinkage in a couple of patients who were really heavily pretreated, a lot of them had over 3 lines of prior treatment. So super exciting and promising in the time to come. So to sum up, ADCs are an exciting new class of drug, though for non-small cell lung cancer, I think we hope to see a bit more clinical efficacy for our patients. But in small cell lung cancer, this has been a really exciting area of investigation and really promising, shown to be really effective even in the later lines. These are novel drugs with new side effects, and basically physicians, nurses, clinics, patients are all going to need to be educated on the unique side effect profiles, which require attention and education to manage new symptoms. But really be on the lookout for these novel combinations with chemo and immunotherapy and other agents, because they're coming. And I think at the end of 2024 here, the future of lung cancer treatment is bright. Thanks very much.